All right, we will let's get started. We have people kind of coming in as we go here, but my name's Aaron Kacharski. I'm a person in long-term recovery since September 6th of 2003, and I'm originally from Rhode Island, and so this vote recovery event for Rhode Island, for New England, is near and dear to me. And I still have a family in Rhode Island. I know a lot of people in recovery in Rhode Island, and Recovery Advocacy Project is working to lift the voices of the grassroots. We tend to think and act locally. And we've been working on this vote recovery campaign across the country. And it's got to be the 8th or 9th event that we've held throughout the country. And the idea for this, the vote recovery effort, came from a town hall, a meeting that we had back in May or June in Pennsylvania. And one of the attendees had asked, how close are we to having recovery be like a single voter issue for people, like the same way that the environment is, the same way that guns and reproductive rights, like those are issues that motivate people to the polls. And the conversation that we had on that town hall was really pretty interesting. And so we said, hey, why don't we duplicate that from now until election day and really talk about what it means to vote recovery. And then we started asking ourselves that question: what does that mean to vote recovery? And what makes a recovery voter? And, vote recovery is not about anybody saying you have to care about this and this and this, and then you're a recovery voter. That's really not what it's about. We've highlighted people in recovery that are voters, and ask them to share about the issues that they care about that inspire them to get involved in their community, or inspire them to get to the polls. And so vote recovery is really about this own individual process for all of us. I voted last week, and for me, vote recovery was about engaging the candidates that I knew were running for office locally. And I started conversations with a lot of them. There was 5 of them that really, by the time I looked at my ballot, I had already had conversations with 5 of them. And the way that I started that conversation was, this is what it's going to take to earn my vote. And that's how I started that. And think about how if we all were able to do that, to talk about the issues that we care about. So when candidates are elected, they have that connection to the recovery community. And we did some polling around this whole single voter issue sort of piece to it. And it turns out that we had actually asked 1,200 likely voters. So these are people that were registered to vote. They weren't necessarily have a connection to recovery. And we asked 1,200 likely voters if they would consider crossing party lines to vote for a candidate that had a better stance on, like a more attractive stance on mental health and addiction issues. And 42% of those voters said yes, they would. And then another 30% said they were unsure, but they would consider it. And then the rest, 25, 30% said no. And those are just, that's just registered voters. And then we asked that same question to people in recovery and supporters of recovery, and that if they would cross party lines to vote for a more attractive stance on addiction recovery or mental health. And that number skyrocketed to over 80%. It was almost 90%. And so we are a very motivated, fast growing voting block. And so, it's important for us to so as we're hearing from recovery voters tonight, go through that process for yourself, and think about the issues that you care about that are going to inspire you. And then also we built a recovery resource hub. or it's a recovery voter hub. And we're going to show you some of that. And so you can dive right into the issues that you care about. You can check your polling location. You can check your voting status. You can learn about voter suppression. You can learn about all these different issues, voter eligibility that is affecting people. And so we built that for you. So we're going to show that to you. And then the last thing I want to share before we get started on this vote recovery event is that remember I said we asked over 1,000 people in recovery, if they would switch candidates. We also asked them if they knew where their candidates stood on the issues. And over 50% just said, nope, not at all. And so vote recovery, on one hand, we say, hey, we would vote for a more attractive candidate on issues that we care about. But on the other hand, we're saying, but we haven't done the research. And so vote recovery is about empowering you all to dig down and do some of that research and talk to candidates. And we even have, I mentioned we've done 8 or 9 of these, and we have people in recovery and family members and supporters that are like running for office. We have first-time voters. We have voters that have gotten their voting rights back, that are casting ballots across the country, and that's all really exciting. And so I'm going to pass this off to Garrett Haid, who's going to actually talk a little bit about the voter hub that we have built, and then we're going to dive right into hearing from some recovery voters in New England. And so I'm looking forward to this. Again, I'm from Rhode Island, and so I've been looking forward to the New England one for a little while. And so Garrett.
Cool. Thanks, Aaron, and thank you all for being here, and thanks for everyone who is about to speak. I appreciate everyone's participation. My name is Garrett Haid, and I'm a person in long-term recovery since March 3rd, 2015. I'm going to share my screen. I'm going to do this kind of like the abbreviated 5-minute dive into the Recovery Voter Hub, just so everyone has a sense of what's in it, how you can use it, some ideas, and some, I just wanted to, before I dive into it, just preface 4 years ago was the first time I ever voted. And ever since then, I have been engaged in the political process. But, right now we live in a time where everybody is, obviously hyper-focused on this massive presidential election, right? But we can't lose sight of the fact that many other races are happening, and the people who affect change and control what's happening and interact with us in our daily lives, it's not the president of the United States. It is our local officials. It is our sheriffs. It is our state representatives. It is our House of Representatives, our senators. And like Aaron said, I've also been able to engage with these people. And I promise, if you engage with these elected officials, as intimidated as I was 4 years ago, they need us and they rely on us, and they will listen to us, but only if we are an organized voting constituency, because that's how politics work. So I'm going to share my screen. I'm going to stop my video so my internet works better, and I'm going to just open this up. And if you, Aaron, I don't know if you did already, but if you could put the web, you did. Okay, if you could put the web, so it's recoveryvoices.com/vote, and it'll take you to our Recovery Voter Hub. Like I said, I voted for the first time 4 years ago and got involved politically, but I relied on, mentors and people who knew this arena and space to kind of just guide me. I wish I would have had tools to, help me engage in the process. So we kind of built that we built this, understanding that not all of our community has had a presence or engagement in the political arena. So this is kind of like a simple step-by-step process of what you can do and how you can identify issues. But we started really quickly with step 1, and Aaron touched on this, the scientific polling we did. And this is just based out of Clark County, Nevada. Like Aaron said, these weren't recovery people. These were just, people that were in the voter database that have registered as voters. And they answered this question. And, knowing that 42% of people will switch party lines if somebody has a better stance, not recovery people, the United States voting bloc will switch. That is a powerful tool for us when we're engaging elected officials. The fact that 34 were unsure means that there's persuadables out there, right? So like that is a majority of people who we could engage and use that data to influence elected officials. So it is here for you. And if you come here and you click on organized voting issues, you can access this data. We published it. We put it online for everybody. And you can use this in your, if you're approaching your own elected officials. Clark County, Nevada is a very diverse community. It's a good representation of the country and of the voters in this country. The other thing that we put up here, which I think polling is really, and our community hasn't always used information like this, but it allows us to frame conversations to influence things. So like if we know 68% of registered voters believe judges should have more discretion when sentencing nonviolent people who have substance use disorder or related crimes, like knowing that is a powerful tool for us of when we're framing questions and we're trying to get elected officials to engage. Like if that's a good issue to engage them on. 79% of registered voters thought stigma was a huge barrier to care. Again, a powerful tool for us to have. And then we also posted the results, and I won't go line by line with this, but this is from the recovery community. We polled nationwide. I think almost 1,200 people answered it. You could take the survey yourself. But again, all of this, access to naloxone, alternative sentencing, these are all, I think 94% of the people who have taken this poll are registered voters. Again, this is just data that you can have at your access to, reach out to your own elected officials. So take advantage of that. Step 2, issues, right? When we say recovery related, recovery voter, like a number, and the list will go on and on and on of issues that could, engage our community or inspire people to get to the poll. Maybe you're really interested in recovery support services, you're a peer specialist and you want to, expand access in your community, or criminal justice reform and ending the war on drugs. When I was doing this 4 years ago and I was first meeting, our local congresswoman and all these things, like I knew I did research on housing, but there was a lot of other issues that I could have brushed up on, right? So we put this resource hub here for you. So if you want to learn more about, affordable housing, insurance discrimination, voter restoration, recovery support, criminal justice reform, mental health, all of these links will take you to a knowledge base of a well-established organization who deals specifically in these areas. So you can use this, you can learn more about these issues. Maybe you're taking a meeting into an elected official and they're going to talk to you about insurance discrimination. Come here, brush up on your knowledge, learn about it, or maybe you just want to, learn for yourself about these issues. It's all here for you. We will continue to build on this. This is obviously not every issue that relates to our community, but this is where we started and we will continue to build on this. But please come here, like Aaron said, this is, about voter engagement, but it's all, voter education. Like we can't fight for the things that we want change if we don't have the knowledge around it. So step 3. So this was and I've gotten a lot of questions about this, right? And this is really personal to me because when I started 4 years ago, like I said, I didn't know anything about the political process. I didn't know, and I have gotten messages of people saying the same thing, so I know I'm not alone, but I didn't know that there was a difference between a US representative and a state representative. I didn't know there was a difference between a US senator and a state senator. I didn't know that if I wanted to expand housing in the state that I was living in, that I probably shouldn't be only targeting the governor, that maybe I could talk to my local council person or my or the mayor of that city. Not everything that we want to fight has to be a direct letter to the president of the United States, right? We can probably go to the school board if we want to expand access to prevention programs. I told this story last night, and on a few other, my friend overdosed 2 or 3 weeks ago now, and he was found in his car while overdosing. The police officer who responded had naloxone on him. And my friend's alive today and in treatment because that police officer, per department regulations, carries naloxone. If he would have overdosed a city or a town or county over, that police officer, by order of his sheriff, an elected official, is not allowed to carry naloxone. So depending on what street he overdosed on, he may or may not be alive today. That is an elected official who has a mandate and an order for his police officers not to carry naloxone. That's why when we say like local, state and local is what we're trying to focus on, is because these are the people who make decisions that will affect our community day to day. So you can come here and you can learn about what your attorney general does, what the mayor's responsibilities are, what the school board members' responsibilities are, judges who we interact with on a daily basis. Like, these are important positions that we should make sure that judges are understanding the needs of the recovery community. So this is a big help to me. It would have been 4 years ago, and I encourage you to come here and just educate yourself on different positions in the political process. And then finally, for step 4 is vote, right? Here it is. You click view voter tools, and right from this site, you can register to vote. You could check your voter status. I hear a lot when we're doing these that I'm a convicted felon, I can't vote. Check your status, because I thought the same thing, and that was not true. Sometimes different states have different rules and regulations of how to get your rights back. I actually didn't have to do anything. I didn't live in the state where I was convicted, and I'm an eligible voter. But I didn't know that. I was kind of just listening to secondhand knowledge, right? Early voting, if you need guides or tools on how to do that. Coming up close to election date, if you're not voting by mail and you need to find your closest polling location, you can do that. Registration deadlines, and I'm pretty sure, Aaron, if you give me a thumbs up, if he put the pledge in there, we put a vote recovery pledge here as well. We ask everybody on this call to take the pledge. Not only will you vote, but you will ask a friend who isn't voting yet, maybe, to go and vote as well. And then finally, the last thing, since we're talking about, the voting, it's coming up, right? Or you're in the process of doing it. If for any reason you find yourself in a position where you are being blocked from casting your vote, intimidation, suppression, you feel like your voting rights are being violated, you can come here. There's report voter violations. I won't go through it line by line, but if you click on that, there is numbers and websites and places where you can report violations if you feel like your voting rights are being violated. So there's much more here. I encourage everybody on this call to share this resource with your communities. Come here, learn. On November 4th, this site isn't going down. This isn't the last election cycle that we will have. We will continue to build on this. The tools will be here for us and our community always. So please take advantage of that. And Aaron, if I didn't miss anything, I think we'll kick it off to Carol.
Some reason it wouldn't let me unmute. Hi, everybody. Oh God, I'm so happy that we finally got here. It's been a long month of planning and sending out invites to get this up and running. Everyone, if you don't know who I am, my name is Carol Cruz. I'm a woman in long-term recovery. My pronouns are she, her, hers. I am in Connecticut. I'm also a region organizer for RAP, for the Recovery Advocacy Project. And I'm really so excited to hear our speakers tonight. You're definitely going to hear us dive into what motivates us and why we're here and why we vote. I am also an advocate, and I have a nonprofit here in Connecticut. you know, and I just want to put it out there, you know, one of the biggest reasons why I vote is that, you know, I have a 26-year-old who came up with me in my recovery. And, you know, I just want to be that power example to young people. I think right now we're, you know, the climate that we're in, it's super important for us to continue to be open to learning and knowing where we stand in voting locally, state, and on the federal level. So with that, I am going to pass it off to Liza, because Liza and Cam are actually on call. They're emergency room peer recovery coaches. And so I want to make sure that we give them their allocated time to share. So it is, let's see, where I lost you, Liza. Where'd you go?
I'm here. I'm unmuted.
Perfect.
Okay, good to go. Awesome. Oh my God, the screen just blew up on my face. Okay. So hi everyone. My name is Liza. I'm a person in recovery. I've been in recovery since December of 2013. So I serve as one of the state leads for the state of Vermont through the Recovery Advocacy Project. I'm not originally from Vermont. I moved here to go to college. I just recently graduated, but I plan to stay up here. And a little bit about what I would like to talk about just with the short time is access to treatment here. So I think a huge part of, first of all, having this event for me and for others who maybe aren't speaking, but just listening, I view this as like a huge piece of, you know, educating about, you know, what, just like what we're seeing and what's happening. And everything that Garrett went through about, you know, like finding who to contact for like maybe what issue at your state or national level, like that's exactly like how, you know, there needs to be more education about that and how to go about this. So really grateful that we all have that resource. So access to treatment in Vermont, as Carol mentioned, myself and actually my supervisor is Cam. So we have a team that works in the emergency department providing 24/7 coverage, and anyone who comes into the emergency department here looking for treatment or maybe identified by you know, a provider or the nurse, whomever it is, and is interested in getting in recovery or maybe getting back into recovery. That's why we're here to you know, make that hospital setting maybe even just a little bit more comfortable for them. So right now in Vermont, especially since COVID, already there is a shortage of beds in Vermont. There has been for as long as I've been here, 5 years. And with COVID operating at like about 50% capacity, we see this almost every day where folks are really eager to get into treatment. They're eager to get sober. Most times, the hospital is not in a position to be able to keep them. Detox beds are full, and we call treatment centers, and they come back with like a 2 to 3 week wait list. I'm all for having people like, you know, really trying to like meet people where they're at in their recovery. But to have someone be told that, you know, it's going to be 2 weeks until you get a bed and they're ready now, like they're ready to do the work and to go through all the uncomfortable pieces, it's unrealistic, you know, for them to stay sober, and not because their intentions aren't in the right place at all. It's because to put someone through that withdrawal and that detox when, you know, like, it's hard to explain like in words. I'm sure, many of you on this call are like familiar with withdrawals and detox. Like that's, it's just such a disservice to not be able to provide treatment at the time. So there's definitely a lot of local officials and many more people who are running for office here in Vermont that are definitely aware of this issue and try to speak up about it. There's a number of advocates, like specifically in Burlington itself. But that's a huge issue that, I said this a couple days ago when we were prepping for this call, but You know, there's 101 things that you could talk about that, you know, need to be changed in terms of stigma and, you know, access to treatment, medication assisted recovery, whatever it is. But for me, that's a huge thing that sticks out and something that we see all the time. I share a little bit myself. I had just turned 16 when I got sober, what was ridiculous for me at the time. But by the grace of God, like there is a treatment center, an adolescent treatment center for that matter, where I grew up in Buffalo, New York. That place was only in existence because a businessman in Buffalo lost his daughter to addiction when she was 13. And not every community is fortunate like that to have that resource. And the rate I was going when I was 15, 16 years old, I don't want to think about what the possibilities may be if I didn't have that opportunity and that resource and privilege, like to be able to get into treatment 2 days after a bed was requested. Like that's not happening right now in Vermont. And that's something that I really believe needs to change. One kind of thing I want to finish off with would just be, I think, education and like being aware of what's happening in your community, being aware of, I think that story that Garrett mentioned was, you know, pretty impactful. Just if it's decided upon like what street and, you know, like what officers and what department carry Narcan, like that's like exactly the type of stuff that we like as advocates like need to be aware about. And not even if you don't consider yourself an advocate, like think about it. I think it's pretty hard to find someone who hasn't been affected by someone struggling with substance use disorder now, whether it's a family, friend, whatever. And it's you know, like we all have our strengths to be able to make some change at all different levels. It doesn't need to be like this big monumental thing. So with that, I think I'm finished. Talked pretty quickly, but I think I got out all of what I wanted to say. And yeah, I can drop some of my information in the chat section if anyone wants to reach out. I believe Kim Blake is on the call too, and we share the state lead role for Vermont. So I'm sure Kim is open to any questions as well. But thank you all so much for being on this call and taking the time tonight.
Thank you so much, Liza. And, you know, one thing you brought up in regards to, you did such a great job, and you brought up, you know, learning what your local representatives are doing. And, you know, we just a town over from here, one of the police departments is actually handing out harm reduction kits. And they're one of the states that or police departments that are doing that. And again, it takes advocating. It does take a village. It takes learning. You know, we don't know what we don't know. So thank you so much for sharing all the great work that you're doing there in Vermont. I'm going to go over to Cam if Gordon doesn't mind, just in case they get called, and I don't want to lose Cam. So Cam, if you're ready, we'd love to hear from you.
There we go. Okay. Sorry about that. Hi, my name is Cam. I'm an individual in long-term recovery. I am a registered voter in the state of Vermont, originally not from Vermont like Liza. I grew up in Baltimore, Maryland. That's originally where I first tried getting sober. And I think there's a sentiment that's shared of, you know, I needed to hit that bottom before I realized that I needed to change. And so what I've seen in the work that I do and Liza shared is like that bottom is very different. That bottom is very subjective to individuals. And if anything, like, you know, in reform and policies and looking at policies and the rights that I have to vote, I'm grateful that I have that opportunity. I'm also very lucky, you know, that I'm not a registered felon, that I have the ability to vote in the state that I'm in. And, you know, that's a gift that I see today. And also another reason why I need to vote, so that I can carry the same beliefs and concerns to that ballot and also affect change that you know, that can create change in my friends' lives who are also felons. And we can focus on reform. So when I look at change and I look at reform, I look at making that bottom a bit more shallow, if that makes sense, that individuals don't have to reach the depths that I did. So it was like, you know, in and out of different states, in and out of treatment centers, in and out of jail, and then eventually being homeless in Vermont and not knowing, you know, where my next meal was going to come from, where I was going to stay. And then eventually finding recovery up here. And so what I see in the work that I do today is individuals who are still struggling and going through those same cycles. And regardless of how many times that they reach out, there are still individuals who still aren't able to reach that next step, to find their own recovery, to find their own sense of meaning. It also helps that I'm a cisgender white male too. So every time that I was pulled over, I didn't have to fear for my life. You know, every time I had an interaction with law enforcement, it didn't even cross my mind. And that's a privilege that I carry, and that's a privilege I'm aware of. So what I focus on is just overall policies that affect stigma and that affect shallowing out that bottom for individuals. You know, it shouldn't be by luck that I've found sobriety. It should be by, you know, actual legislation and policies that sobriety is available for individuals, not just myself, because of where I come from, my socioeconomic status, the color of my skin, my religion, the way I talk. You know, that is something that should be granted to everybody, just like medication, just like, you know, any other form of treatment for any other illness that's out there. It should be available. So what we have is something that's interesting. It's a disease, but it carries a whole lot of stigma with it. And it's not something that can be compared to another disease, even though we use that to try and rationalize with individuals as to what this is. You know, as if it's also being used as a way to, you know, inflict harm on individuals that was represented in our presidential debate. You know, when President Trump started to discuss Vice President Biden's son and his issues with drugs. So this election year, the time that we're in, it's that word unprecedented, which is, I hate it. I've heard it so many times. It's such a cliche. But we're truly living in a time that's hasn't been gone through before. And it's almost as if we're in the 1950s, but it's maximized because everything is now in front of our face. Everything is being visible to us because we have access to cell phones. We have access to videos. The truth is coming out. You know, I'm grateful to be in this position right now, but there's still so much more work that needs to get done. So to continue with what Liza had mentioned, there's a lot of reform that needs to be focused on regarding treatment access in the state of Vermont. There's a lot of reform that needs to happen regarding policing practices and also interactions with individuals in recovery and what that might look like. So when I'm voting, and I have voted with the mail-in ballots, you know, I have that in the forefront of my mind as to what I'm voting for. I think that covers it.
Cam, I could absolutely listen to you all day. And please, I'd love to touch base with you.
I hate hearing myself talk, so thank you.
Yes, thank you so much. You did a fantastic job. Everything you spoke about is, you know, definitely, you know, where we're at. You know, we're not reaching our marginalized communities. We're not, you know, it is not even across the board. I even have recently spoke about my own understanding and growing up with privilege, but also too, you know, how are we who are we reaching and how are we reaching it? And we're not speaking we're not speaking the appropriate language, you know, and we're not removing those barriers to get people to treatment. So that is what I want to, as an advocate, represent in talking with my local and state and federal folks. So thank you so much for Cam for sharing with us today.
Thanks.
And next up we have Laura.
Okay, there. Can you hear me?
We see your cat. We don't see you.
Okay, well, you have to just unmute. Can you hear me now?
Yeah, we can hear you,
Okay,
but we don't see you.
my face is the other one. The cat is the one who's talking, who also just actually had a little mishap in the middle of the last speaker. I apologize.
There we go.
It's always when you're in the
It's
middle
all
of
good,
something.
Laura.
Anyway, I agree. What I wanted to talk about, especially, I know that we're a multi-state meeting here right now, but I want to talk about, I think this crosses the country right now, is what happens to people once they get out of a rehab? And why is the recidivism rate so high for people with reoccurrences after they get out of a relapse, or out of a rehab? I'm nervous. Sorry, guys. Let me breathe. Okay. I'm sure you can all agree. But what my experience is, I've been in long-term rehabs, I've been in short-term rehabs, I've been in IOPs. And the last rehab I was in was basically, I went for 28 days. It will be my last, by the way, but 28 days. And then it was a 90-day program afterwards. And when I walked into the 90-day program, they said, well, only 1 in 6 of you will maybe stay sober and clean. And I found that horrific. And I said, well, they're just saying that to scare us. But now, over a year and a half now out of that program, my graduating class, only 5 people out of 28 stayed clean and sober. And that percentage, I think, needs to change. And what makes me passionate, and what I want to bring to the legislation, is how can we regulate what happens to people after they get out of a rehab? Because in Connecticut, if you can get a mortgage, you can call yourself a sober house. You don't have to have any kind of, there are organizations there's one called CTAR, I know, that approves certain sober houses, and that's great. But you don't have to be CTAR approved to call yourself a sober house. And so what we end up with is, a lot of times, and again, this becomes an access of care and equity issue. People that have money can afford the expensive sober houses, and people that don't get put into these basically glorified rooming houses that call themselves sober houses. But there's no regulation, no one's in charge. And I know for myself, after 28 days, if you put me in a sober house where my family feels safe that I'm there, but no one's running the show, people are using when they want to, and yet rehabs are referring to these places, and I think that has to change. I think that we need other options for people of all economic backgrounds and racial backgrounds to have an option when they leave a rehab to stay safe, because I'm not happy with this fact that 1 in 5 or 1 in 6 stay clean and sober. We're better than that now. We are all trained. This is not 1935. We don't have to meet in church basements. We are better than that. We have science behind us. We've got, research behind us. We've got people that are trained to help us, and it's just not happening. I also, question that the proportion of beds for men versus women is enormous. It's like for every 100 beds, there's 75 for men and 25 for women. In my treatment center, or my long-term treatment program here, we had 28 beds and only 9 were for women. And none of them, by the way, in any of the places that I've been to, provided for women with children. There are no sober houses that, if you have custody of your kids, that you could take them to in the state that I'm aware of. So a lot of the women that I was in sober houses with had to find other places for their kids, or the state had to take them. And that's a problem, because what's going to help a woman stay sober if she's going to lose her kids on top of it? It's very complicated. And I think that I agree with the fact that I don't think the president, whoever gets elected as president, is going to change this. I think that the grassroots efforts, like what we're talking about tonight, have to start at state level and town level and local level. I make a plan tomorrow to call my own local police department because I forgot about that. Are they carrying Narcan or are they not? We had a police officer in my town make a public Facebook post on a public page that Black Lives Matter is for terrorists. And he's a cop and he never got penalized for this. They didn't fire him. They didn't do anything. They just said, oh, poo-pooed it away. And, you know, that's another problem. So how are we facing overdoses like that in my town? But that wasn't why I meant to talk more about, God, I'm so nervous and there's no reason to be. Public speaking is not my forte. But anyway, for me with the state of Connecticut is I would like to see better regulations on what to do with people once they leave rehab. And I'm a member of a couple of different, I'm gonna put my phone down because that way I stop looking at things, my face in particular. But you know, I'm a member of several other Facebook pages of families and allies for people in recovery. And they're constantly talking about how they can't find beds and how they can't, once they get a bed, the person can go into detox and then they don't have a bed to go to after that. Or they eventually get into a rehab and then they get released from the rehab. But I don't know about you guys, but when I reached my last rehab, my family did not want me to come home. They were like, you have not been in rehab long enough. You need more help, girl. And the long-term options for people that are on state assistance or Medicaid or unemployed are very, very limited. And, you know, obviously I had privilege, but it didn't help when I got thrown out. My privilege didn't matter because I had no money in my pocket in that point, you know, and I had to fight to find a place. I cannot imagine what it's like to be in inner cities and to be Black or brown trying to fight for a bed. Because I know the beds here in the inner cities for detox and rehabs, the last time I checked were at least 4 weeks out. And if you want to go into a detox, you need to either be using your drug of choice, you know, a drug or alcohol. They're not going to take you into a detox if you're, you know, been 48, 72, whatever hours clean. So then what do? They tell you, okay, you got to wait 2 weeks. So don't use for 2 weeks because you might die. But the day before you come in, please use. That's ridiculous, in my opinion. And, you know, I have a lot of concerns with what the insurance companies will pay for and what they won't. I was lucky because when I went to rehab, I was on our state Husky plan. So I got into a rehab. And the state plan, which they give only to people that are unemployed, let me stay 28 days. For my friends that were on Anthem Blue Cross or other, you know, HMOs, they had to call, that the clinicians had to call every single day to justify why that person had to stay longer. So I got a month not working, but someone who was working, paying into the program, could maybe get 2 weeks and then got bounced, you know, and you know, there's so many things that are unfair. And what makes me want to talk to my representatives, and I know it's going to have to be local to start, is why is our reoccurrence rate so high? For people, you know, you get them into rehab. I was in rehab with a lot of people that wanted to be there, but they had nowhere to go when they got out. And guess what they did? You know, and that's why we had this huge percentage of people that, you know, that's why the public, you want to talk about stigma. The reason we have stigma is because our reoccurrence rate is so high. Well, why do we have a high reoccurrence rate? Because there's no support for people when they get out of a rehab. And so what do you expect? You can't, if you have a lifelong substance abuse disorder, you're not going to get cured in 28 days. You'll be detoxed and you'll be through withdrawal in 28 days, and you'll maybe be fed and maybe your vitamin levels will be high, but that's just a starting point. So I know that I know for a fact, and this is not my opinion, the federal government is not really going to address this right now. So we have to start at our state levels and our local levels and hope for the best when it comes to that. And then maybe if enough states and enough families, because addiction is affecting families in every colored state and every political party and every color of skin and every religion. I've seen it a million times. It doesn't matter. It's non-discriminatory. So maybe if enough states and enough things get on board, then we can push for a federal jurisdiction over this. But I would just like to see my state take a little bit more responsibility in aftercare and equity and sober living, and to make sure that, you know, if I come out of a rehab and they say, well, you know, John Smith's sober house, here you go. Well, I show up at John Smith's house and everybody's using pills, you know, there's no regulation.
I'm sorry, Laura, but we do have to move on. We have two more.
I thought it was too short. Okay, sorry, go ahead.
No, but thank you so much. Thank you so much. We so appreciate everything that you touched on. I know recovery residencies is a huge passion of yours. And I think a lot of us, I mean, all our states, you know, there's so many sober living out there that are really not, you're not living, the people are dying in these sober houses that are not regulated. So yes, we'll definitely talk more about that and see how we can get to our local representatives to get some regulations going. So thank you so much, Laura. Next up is Gordon, also from Connecticut.
Hello, everyone. First, let me say it's an honor to have been asked to participate in this. My name is Gordon Lyde. I'm a person in long-term recovery here in Connecticut. I live in Torrington, Connecticut, way up in the northwest corner. My sobriety date is 12/22/2008. Wow. I was sitting here, Liz, I already had some notes about things I wanted to talk about. And then I listened to Laura and Cam, and then it sparked a whole bunch of other ideas, Garrett. Like Laura mentioned, my biggest thing is what happens after treatment. First, let me say, with voting, I didn't start voting until, first time I voted was when Obama ran, and it was only because he was a man of color. Previously, I never voted. It wasn't something that was pushed on me. It wasn't something that was talked about in my community. It really wasn't. And I didn't see the importance of it. I only looked at presidential elections because as a convicted felon, I was only allowed to vote in presidential elections. Local elections, I wasn't allowed to. But lately, I see the need for it. So I've been working with we have a young man here in Torrington that's running for state rep of District 63, Noel Rodriguez, and he has this grassroots approach. And so I've been helping him as much as I can with his campaign because he wants to address these issues that when I speak to him about, because I told him my heart is into, and my passion is, like Laura mentioned, when you get out of treatment, because what happens is you go to treatment, you get all these tools, you share all these things, you get all this, you get a ton of information, tons of it. And then all of a sudden, whether it's a 28-day, sometimes you go to detox in a 28-day, then you may go to long-term treatment, however your insurance provides, then you may go to a sort of a 3-quarter house. Then all of a sudden, it's graduation day. You've been in a secure, safe environment for 9 to 10 months. And then they give you a tap on the back and add a boy and a certificate and say, figure it out. And what happens is one of the statistics is 1 out of 30 make it. And out of that 29, 20 of them relapse within the first 60 days. And I've been looking at that. And what happens is it's because there's no help with those stressors. They're not prepared to deal with the stressors of life. You come from an environment where you have 0 to no responsibility. And then all of a sudden, you're out there in the world, you got 10 months under your belt, you're clean and sober, but no one showed you how to do a resume. No one showed you how to deal with some of those past debts. No one walked you through or even gave you a heads up for what to be prepared for, because life is going to throw you some curveballs. And how do you handle that? you were in treatment where you talked to a counselor and you recognize that desk in front of you, that it was that desk represent HIPAA. They can't share my secrets. So I can tell them everything, my biggest fears and everything that's going on, what I'm definitely afraid of. And all of a sudden I'm out there and you tell me to go to a meeting and tell a complete stranger that I need help, that I can't read, I can't fill out an application, that I have no skills, no marketable skills to my knowledge. That's a lot to ask for someone that's barely holding on from not using from moment to moment. The federal government, because of this opioid epidemic, because now all of a sudden it's an epidemic because it reached certain corners of the world. I know people have been dying of opiates since the 70s, but it's an epidemic now. So now they're shoving money out there to different organizations. And that's great. They could provide treatment, but there's nothing helping the individuals once they leave. There's nothing available for them. And so what happens is they give it the good college try for a week, 2 weeks, then when nothing happens, they go back to what they know, numb. They want to numb the feelings because now what little self-esteem they were working on has been shattered because now they're clean and they're still in the same boat. That needs to stop, which was one of the reasons why I started pushing for local politics, because that needs to change. We need to start voting on a local level where we have those officials that can start pushing to implement some change in there. That's why I vote. That's why I push people to vote. Because it's great to those big elections, but let's be honest, there's no policy that's going to happen that can be implemented on a government level that's really going to affect us within the next coming months. But a local election, those local officials can help with those little things. You have a voice in your mill rate. You have a voice in property taxes. You have a voice in whether schools are open or closed or what happens in programming, different things, helping the homeless, because the homeless, that seems to be where a lot of our people wind up at once they relapse, because like Laura mentioned, families close the door, turn their back, so they're there. So what are we doing for that? How do we help them? That's why like I mentioned, the young man, Noel Rodriguez, he really helps. He has a passion. So anybody with a passion to help people like me, and not just my ethnicity, but people like me that struggle with addiction all of their lives, I will back you. I will back you. I will carry your banner and I will promote your name everywhere, because that's what we need. We need more awareness of what's going on, because there's not a family anywhere that hasn't been touched by addiction. If we look at the numbers, the recovery community make up a lot of numbers for coming together. We can use the power of that vote to implement change. We just got to come together and utilize that power that we have. First, we have to recognize it, then we have to utilize it. And that's my passion. That's what pushes me to get out there. I make phone calls I got a list of constituents and I call them and see where they're going with it. I'm on the phone all the time. I'm out in the community. When I'm not working, I'm working on that, because it means something to me. I want to try to help so the next person don't have to struggle as hard as I did just to stay clean. We need to do better. We're worth more than that. That's my motivation in a nutshell.
Thank you so much, Gordon. I have the utmost respect for you. You and I have known each other for quite some time, and everything you do as being a certified drug and alcohol counselor and recovery coach, you're doing so much in your community there, especially up there in Torrington. So thank you. I appreciate you so much and for being here tonight. And last up, but not least, is Courtney.
Hi, everybody.
Hey, Courtney.
My name is Courtney Allen. I am a person in long-term recovery. And for me, that means that today my children have a mother, my school has a scholar, and my city has a candidate for the Augusta City Council. I am running for local office right now. And how I got to this moment is a pretty long journey, but I think there was a couple pivotal moments in that journey that I would like to share with you tonight. I do not come from a family that has ever run for local office, nor do I come from a family that really ever even voted. Nobody at my dinner table was talking about the presidential election or who was running for governor. But when I entered recovery, I had a friend one day, his name was Andrew, and he called me one day and he said, "Hey, Courtney, I'm going to the legislature and I'm going to go testify on this bill." And I was about, I don't know, a year or a year and a half in recovery. I had just started in my undergrad. I was going to school for mental health and human services, and I really wanted to help people, right? And so that's what I thought that I was supposed to do. I thought I was supposed to become a counselor, like many of us think in early recovery. But he gave me a call that day and he said, you know, come up to the state house with me. And I was really, really nervous. And I said, wait, like, I have no idea what you're talking about, for one. And he said, you know, just show up, Courtney. You know, I'll show you how to do this. Just show up. And so I did that. I had learned in my early recovery to say yes. And so I just showed up. And that was a bill about Narcan. And I testified that day. But what I really did is I watched my elders pave the way for me, right? And so they showed me, and over the course of the next year, I would go to these bills, legislations with them, and then we would end up at like work sessions, and I really literally had no idea what I was doing, but I was showing up and I was letting people teach me along in that process. And within that process, my significant other, his name was James, he passed away, not from an accidental overdose, but he was a person in long-term recovery and he had diabetes and he died in his sleep. And I found him and I was devastated, right? And really, really lost in grief. The world got really dark in my recovery, and my recovery community, my advocacy community, was there in the same way that my 12-step family was. They really surrounded me and walked me through that process, and I got on fire, right? So I started opening sober houses and I started traveling all over the country advocating for recovery advocacy policy. And I changed my major in school. I ended up going to school for public policy, social justice. And one of the things that happened was when I had the sober houses, we had a fire code officer come to the sober house and he said that we needed to install a sprinkler system. And I ran low barrier, low cost, volunteer run sober housing. We did not have money for a sprinkler system. It was a $50,000 installation fee. And I was like, what do you mean you need to have a sprinkler system? And what I found out later was that, you know, we all know, not in my backyard kind of stuff, right? So they were trying to find a way to close us down, and it would have, that was the thing that was going to close us down. And so I had met this guy, his name was Justin Fecto, and he happened to be my state representative. And I called him over to the house one day and I gave him a tour of the house and I told him what was happening. And I told him that I believed that it was a discrimination thing. And I believed that I'd done a bunch of research on recovery housing, and I knew that the Federal Fair Housing Act covered recovery residences as a single family home. And what that meant, I could go on about this forever, but what that meant was that what they were doing was illegal. And I had pamphlets and legislation and laws and lawsuits, and I showed it all to him. And I was like, what can you do? What can we do to fix this? My people are going to end up on the streets. And, you know, he was really interested, and we ended up putting in legislation to create a statewide policy that covers recovery residences in our state from this time of discriminatory action by fire code officers. And so we hosted, like, we had to put together a testimony day, and all of my recovery housing people came with us, and we showed up in droves. There was like 20 of us in recovery, and we did it. We did it, and it passed the work group, and it went to the House floor, and it passed the House floor, and it passed the Senate floor, and then the governor signed it into law in June of last year, I think. And another really cool part of this story is that the day that it officially went into law, which is 90 days in my state, I live in Maine, a recovery housing operator called me and said that his city was trying to do the same thing, and that he was going to take this law down to City Hall, to the City Council meeting. And he did that, and they were like, oh, we can't do that. We can't force you to put a sprinkler system in and try to shut down your house. And we also like built in protections into that law that for the law to cover the house, they had to abide by certain rules, and in particular national standards of recovery residences. Recovery housing is something that's like super dear to my heart, ensuring that people have safe housing, and that kind of feeds back to James, because he died alone in a 1-bedroom apartment, and I feel like if we had something for him at that time, that he may be still with us. But James was really amazing. He was loud, and he was proud of his recovery. And when I first met him, I was quiet. Like I read books, I sit in my room, like I'm very introverted before this whole like journey of recovery advocacy and getting involved. But before that, like I didn't talk, and James like was my voice. But when James died, I like to believe that he left me his voice, and that I have a responsibility to speak for some people that don't yet know how to speak. And I say yet because I believe that as elders in this community, that we can teach the next generations to get involved. And we desperately need all of us at the table. Like really bad. We need to run for office. We need to vote. Well, you can start by voting, and then we'll teach you how to run for office, because it's a journey and it's a process. And today I actually had my candidacy profile come out, and the tagline on my candidacy profile was previous counselor, which is the person that I am running against, or the previous counselor and drug recovery advocate vie for the city council seat. And my platform is based on staying true to myself, not backing down from my identity as a person in recovery, and as a recovery advocate. I am working, my platform is really about affordable housing, becoming a recovery ready community, and fiscally responsible policy, because my community, as many other communities, is really struggling right now, especially as we move through the COVID process. And one of the things that is will be on our agenda come Jan 1 is whether or not to build a new police station. And these are like the issues that we don't think about, right? Like as being recovery policy issues, but they are, right? If my city wants to spend $20 million on a new police station, I kind of got an issue with that when my people are still dying. My people are dying at a higher rate than COVID right now in Maine. I'm not saying that COVID's not real or that it's not a public health crisis, but what I am saying is that my people are still dying. And we need to talk about the budget. Our city council budgets are like a moral document about how we want to spend our money and what is our values and what matters, right? And $20 million is a lot of money. And so I want to be at the table when we have that discussion. So that's a lot. You don't have to run for office today. You can just start by registering to vote, and then on November 3rd or before, go vote, and then we'll walk together and change all the laws and burn the systems to the ground. So thank you so much for having me.
Thank you so much, Courtney. I just, the song Burning Down the House just came to mind. I watched David Byrne the other night on HBO, and you are so inspiring. You're definitely my hero. I have a girl crush going on right now, just for all the work that you're doing in your state. You know, inspires me. I've never even thought of, you know, going to that level, but who knows what will happen in 2021. I am sick and tired, like most of us are being sick and tired. So I just thank you all. And thank you, Courtney, for sharing what you're doing in your state. It's so inspiring. And everybody, thank you, all our speakers. We do have a little time that we'd love to have Tom Cordair share a little words of wisdom, Tom. Love to hear from you.
Thank you so much, Carol. I wasn't planning on speaking tonight, but thank you for recognizing me. My name's Tom Cordair, and I'm a person in long-term recovery. Sorry about that. My phone is moving all over the place. I'm a person in long-term recovery, which means for me that I haven't used alcohol or drugs since May 15th of 2003. And so I really related a lot with all the speakers, Liza, Chad, Laura, Gordon, Courtney. You guys were all amazing, and you really brought this to the personal level for all of us. And I think, you know, that's what voting is all about. That's what, you know, being an active citizen and a participant is about bringing our issues forward and helping people to be able to understand how they affect real people. And you guys did that so beautifully tonight. So thank you for doing that. I ran for office when I was 24 years old, way before I got into recovery. In fact, I'm sitting here with my mom tonight. My mom ran for office when she, 10 years prior to that. And she inspired me to get involved in politics as well. And, you know, because we were involved in the community, and you can only get so much done, you know, as a community activist. And I think, you know, Courtney was speaking a little bit to that. You know, you can only get so much done from the outside. At some point in time, you have to make the decision to get involved at a different level. And for us, for people in recovery, when I got into recovery, I already knew about that. I knew that our stories had power. I knew that our voices mattered. And I worked with Aaron Kaczarski on a campaign called Recovery Voices Count back in 2008. And we've come a long way, Aaron, since 2008, when we identified 10 battleground states, and we did non-partisan civic engagement. We did voter registration, educating voters about the issues, educating candidates about the issues, and then making sure people got out to vote on election day. And here we are 12 years later. You know, back then these issues weren't even front and center on campaigns, and today they are for all the right reasons that have already been talked about. You know, people are finally sick and tired of being ignored, and for the reasons of negative public attitudes that exist in the community. A lot of times these things weren't talked about, and now today they are talked about, and you guys are bringing them out into the forefront. You're asking candidates about them. You're writing letters to the editor. You're going on local news stations, and I was so proud to hear Courtney talk about her profile that appeared in the newspaper today. Imagine that, to have actually a profile in the newspaper that says somebody in recovery is running for office and doing this. So to all of you, in my day job, I'm the Sampson Regional Administrator. I'm here as a private citizen tonight, of course, but I couldn't be more proud of the people in my region, in Region 1, New England, the 6 New England states, to have new voices like you. A lot of you I don't know. And I love that. I love the fact that there are new voices here who are getting involved, who are showing up and trying to make a difference. So Carol, thanks for your leadership. To Garrett and to Allison and to everybody on the team who's making this happen. Thank you so, so much for all the work that you're doing to engage people. It's good to be here.
Thank you so much, Tom. Again, you're another person that I can listen to all day and just, absorb and be that learner. I just wanted to close out for tonight. We lost here in Connecticut, we lost one of our pillars in our community, Art Woodard, who never really talked about politics, but he was an amazing person. And just last week, he was put to rest. And, one of the things that I just want to leave you all with is, be curious, have that sense of wonder. But also don't attach yourself to the outcome. Be part of, and just learn from. We can learn so much from each other, and I look forward to learning more from you all. And again, at November 4th, day after election, it's not when it's over. It's actually when we hit the ground running and do the work. And you're all doing the fantastic work. And I just want to thank everybody. I want to thank Garrett. I want to thank Aaron for also being pillars in my help in my leadership and what we get to do throughout this region and throughout the nation. So thank you so much for RAP and also Ryan Hampton. So is there anything you have, Aaron or Garrett, before we close out tonight?
Just that, thank you for the words for Art. He's somebody that, inspired a lot of us. And so I appreciate you talking about sharing him. And we are having just the last thing, thank you to all the speakers. And we are having a national Get Out the Recovery Vote rally on the Sunday before the election. It's November 1st. I'm going to put the registration in the chat. It's just Recovery Voices. If I can type it without recoveryvoices.com/recoveryvoices.com/rally. It is Sunday, November 1st. It's 4 p.m. Eastern. We've, like I said, we've had 10 or 11 of these events, and we're just working to have everybody come to the Get Out the Vote rally. Right before the election. We'll have some guest speakers. We'll have a few recovery voters, but it's like a hype rally, and we're looking forward to seeing everybody the Sunday before the election. And you have to go to register recoveryvoices.com/rally, so that way you can get the Zoom link, and we'll see you all there.
I just
Carol,
want to add, thank you. I just want to add one last thing because, I did see a lot of response from parents on Action Network, and I just want to honor those parents that showed up today. We are here for you. We want to continue to advocate for you because you are the allies that definitely help us in our foundation of where we're going for helping folks in recovery to get to recovery. If you've lost a loved one, we truly, our heart is with you. But I just wanted to honor the families that came on this call tonight. Thank you so much for being here and being part of this process.
Okay. Carol, can I say one quick thing? I see that Courtney has put a bunch of links to some community listening sessions. So this was kind of a forum to hear from our recovery voter speakers. But if you want to be involved and have your voice heard and let the community know the issues that are affecting you, if you're in Maine or people that are in Maine, Courtney's hosting a group of community listening sessions. I know Carol does the same, and all the states actually have these running. So these are the events that we hold pretty regularly. So join them and incorporate your voice into these discussions because we need everybody to help build from the ground up. So the links are in there, but you can probably also just connect with Courtney and she'll fill you in also.
Amazing. Thank you so much, everybody. And vote, vote, vote. I'm going to be there. I'm walking in with double masks. Good night, everyone. Thank you.